Hi, this is Mnemonics. Today we'll be speaking about Parkinson's disease. Okay. I wonder if you have ever seen a person with such a condition. As in, these are resting tremors in which an individual keeps rubbing the index finger and the thumb. Clinically, these are called pill rolling tremors. And this is highly suggestive for a condition called Parkinson. And it manifests itself most of the time at an old age, approximately 60 years. Okay then, what is this Parkinson disease specifically? It is a neurological disorder which involves the malfunction and the death of vital nerves in the brain called dopaminergic neurons. In Parkinson's disease, primarily it affects the dopaminergic neurons in an area of the brain called the substantia nigra. To be more specific, in the pars compacta of the substantia nigra. These are two paired structures found on each side of the midbrain and are the most darker regions of the brain. In Parkinson's disease, these darker regions disappear. And a further pathological hallmark of Parkinson's disease is just the appearance of Lewy bodies. And these are eosinophilic globules, which are seen under the light microscope. These are aggregates of misfolded alpha synuclei and other proteins, but their function is still unknown. The same Lewy bodies we see in light microscope when observing Parkinson's disease are the same which you will see when you observe the Lewy body dementia. Now let's see the functions of dopaminergic neurons. These neurons send message to the striatum, which activates the motor cortex through the part of the brain called the thalamus. And this is specifically for the initiation of wanted movements. So when these type of neurons are depleted, the following symptoms may and will elapse. Symptoms include, first we start with tremors, as we have seen before. In Parkinson's disease, patients have resting tremors, clinically termed as pill rolling tremors. 2, there is an increased and persistent resistance to passive joint movement that is independent of speed movement. And this is what we call rigidity. How then do we evaluate rigidity in a patient with Parkinson's disease? We evaluate this through the Froment maneuver. 3, we have akinesia, bradykinesia, and hypokinesia, in which a patient presents with absence or less or slow movement, generally has problem in initiating movement. 4, we have postural instability, where there is imbalance and a patient always has this tendency to fall. To evaluate this, we'll use the pull test, in which the examiner stands behind the patient and moderately pulls his or her shoulders. The patient's ability to maintain balance is then evaluated. But in doing this, you have to observe the safety of the patient. Use the mnemonic TRAP. In this mnemonic, T would stand for tremors, as I told you. Then we have the R for rigidity, and A for akinesia. Then we have P for postural instability. Other symptoms would include shuffling gait and legs freeze up. Actually, the causes of Parkinson's disease are not known. Parkinson's disease is idiopathic, though some genetic factors are seen to play some role. This should be taken into account that also toxins and medications such as antipsychotics like haloperidol, antiemetics, for example, metoclopramide, and lithium can lead to secondary Parkinsonism. How to diagnose Parkinson's disease? First, we should have this clearly that Parkinson's disease is itself a clinical diagnosis. But in order to confirm this, we use pharmacological tests, for example, levodopa or apomorphine test. And we will know if the result is positive only if the administration of levodopa or apomorphine relieves the Parkinson's disease symptom. Parkinson's disease therapy. In a therapy to control Parkinson, the target is to increase brain dopamine. Levodopa is a drug of choice, and normally it's combined with the carbidopa, a peripheral dopa decarboxylase inhibitor. Levodopa is used instead of dopamine as it penetrates the BBB, blood-brain barrier. We also use dopamine agonists such as bromocriptine and robinurole. And it should be noted that the uses of levodopa and dopamine agonists can cause psychosis and hallucination due to overstimulation of D2 receptors. 3. We use amantadine, an antiviral medication, as it increases dopamine in the brain, but the mechanism is not yet known. We also use the inhibitor of COMT, the catechol or methyltransferase, to prevent the degradation of dopamine, which is produced by the remaining neurons, such as entacapone. And 5, we use MAO inhibitors, for example, seleglin. Also, in patients with Parkinson's disease, and acetylcholine are given to prevent the increase in acetylcholine due to depletion of dopamine, for example, benotropine. Deep brain stimulation can be done but recommended for patients with severe motor symptoms who respond to levodopa treatment but are not sufficiently controlled by it. Here, you would take the mnemonic lamp to memorize the therapy of Parkinson's disease, which L is for levodopa, and A is for amantadine, M for MAO inhibitors, but we also have a B for bromocriptine. We mentioned this as a dopamine agonist. Thank you for listening and hope you found this video helpful. Many more are coming your way, so make sure you subscribe and press the ring bell that you never miss any other updates. Thank you.